Stop scrolling. Today, a team of scientists at the University of Cambridge accidentally discovered something that is about to rewrite the entire future of medicine. For decades, chemists have been stuck using toxic solvents and crushing heat to tweak complex drug molecules during the final stages of development. It was slow, dangerous, and often failed. But what they thought was a catastrophic lab error turned out to be the most powerful tool in pharmaceutical history. In this video, we are going to dive deep into how light-powered chemistry is saving lives by making drugs cleaner, faster, and infinitely safer than ever before. The story begins right here at the University of Cambridge, where the standard practice for modifying complex drug molecules had reached a breaking point. For years, researchers relied on traditional organic synthesis methods that demanded toxic chemicals like benzene or dichloromethane and subjected delicate molecular structures to extreme heat and pressure. It was a process described as brutal by anyone who has ever worked in a lab. You were essentially trying to sculpt something incredibly fragile with a sledgehammer made of poison, hoping it wouldn't shatter before you finished the design. This approach was slow, expensive, and carried a high risk of creating toxic byproducts that had to be painstakingly removed before a drug could even enter clinical trials. The industry was stuck in an industrial-age mindset, treating molecules like bricks rather than intricate machines made of carbon chains. It was inefficient, environmentally disastrous, and frankly, a nightmare for patient safety. Then came the experiment that changed everything. A team of chemists decided to push the boundaries by testing their light-sensitive catalysts under conditions they never intended to use. They were trying to create a specific bond in a molecule, but accidentally exposed the reaction vessel to a broad spectrum of visible and ultraviolet light during a calibration error. Instead of destroying the sample as they feared, the light triggered a cascade of reactions that didn't just work, it worked beautifully. The photons acted like a precise laser pointer, directing energy directly to the exact spot on the molecule that needed changing without disturbing the rest of its structure. There was no heat generation, no toxic waste, and the reaction happened in seconds rather than days. This accidental discovery revealed that complex drug molecules could be modified at the final stages of development using only light, bypassing the need for harsh chemicals entirely. It was a moment of pure serendipity, where an experimental mistake became the key to unlocking a new era of pharmaceutical engineering. What makes this discovery so revolutionary is not just the speed, but the level of precision involved. In traditional chemistry, reactions often happen all over the place, affecting multiple parts of a molecule and creating a messy mixture that requires extensive purification. This light-powered technique offers atomic-level control. The photons can be tuned to specific wavelengths that resonate only with the chemical bonds you want to break or form, leaving everything else untouched. Imagine trying to fix a watch by disassembling it in a hurricane versus having a surgeon use microsculptors. This method allows researchers to tweak complex structures later in the development process, which was previously impossible without risking the integrity of the drug's core functionality. It means that if a molecule isn't working perfectly on day 10, you can fix it on day 50 with zero collateral damage and no toxic residue. The implication is staggering. We could iterate through drug designs thousands of times faster, testing variations in real time while maintaining absolute purity. The practical implications for the global health sector are nothing short of transformative. By eliminating the need for toxic solvents and high-heat environments, this technique drastically reduces the environmental footprint of drug manufacturing. We are talking about a future where pharmaceutical production is cleaner, safer for workers, and much more sustainable. Furthermore, because the reaction occurs at the final stages of development, it opens up a new realm of possibility for creating personalized medicines tailored to specific genetic profiles without the lag time associated with traditional synthesis. This could mean that within years, we will see treatments for rare diseases or complex conditions that were previously deemed too difficult to manufacture become available to patients globally. The speed at which these drugs can be prototyped and tested means that life-saving medications might reach clinics in a fraction of the current timeline. We are moving from an era of trial-and-error pollution to an era of light-driven precision, where innovation is limited only by our imagination, not by chemical constraints. So, there you have it. From a simple calibration error at Cambridge to a paradigm shift in how we build medicines. This isn't just a lab curiosity. It's the blueprint for the next generation of healthcare solutions that are faster, greener, and infinitely more effective. The ability to sculpt molecules with light gives us hope for treatments that were once thought impossible. If you found this breakdown as fascinating as I did, hit that like button to support independent science storytelling. Drop a comment below telling me which part of this discovery surprised you the most. Are you excited about personalized medicine or just the environmental impact? Don't forget to subscribe and ring the bell so you never miss when the next scientific breakthrough hits your feed. Thanks for watching, and keep exploring the unknown.